Okay, Unit 6 is about the residents' living space. So we call them residents, not patients, because they actually reside in the facility that we're caring for them in. And this is their home, this room or this half of room that they live in, and so they're going to have some of their own belongings there. We need to make sure that we treat them with privacy and respect, that we're knocking before we enter their rooms, that we treat their belongings with dignity. This is an example about how they might be bringing some of their things in from their home, like maybe a special chair or a special bedspread, lamp or decorations, things of that nature. You can look through this. I'm not going to read it all off, but there are standard equipment that's found in the residence room, such as like a bedpan or a bedside table, bath basin, things like that. So when you're performing a skill or an activity of daily living on a resident, you probably want to check first before you get all new of everything. Check in some of their drawers to see if they have these things before you go and get new. They have call lights. They have privacy curtains. These are all like standard equipment. So let's talk about those privacy curtains. What are the limitations of a privacy curtain? What are the limitations? Well, there's a limitation when it comes to light. So there is some light that's going to come through that curtain. Smell and sound. So, they can still hear through the curtain. They can maybe still smell odors through the curtain. So yes, it will block some and provide some privacy, but at the same time, we have to remember that there are limitations there. This is an example of what a call light might look like. This is a button kind where you would press the end of it to make the light go off. But there's also a soft touch call light that might be available for somebody who has harder time with their hands, and they can just barely touch that and that'll bring the light on. So something to remember about the overbed table is that it is not meant to put bedpans or urinals on. This is like a place for their personal care items. It's for their tray, food, things like that. So we have to make sure we don't put dirty things on the overbed table. That would be like taking their meal tray and placing it on the toilet. Okay, it's same difference. So we don't put the toilet on their tray, where their tray goes, right? Some examples of disposable equipment would be like cups and tissues and, disposable razors or masks, things like that. So be familiar with what they're talking about with disposable equipment, what the difference of that is. And that helps to prevent the spread of infection. That's the purpose of that. So like if a person's in an isolation room, a lot of times they're going to be using a lot of disposable things rather than bringing non-disposable things out of that. Another thing to be familiar with are different kinds of beds and that are featured or found in a facility. And so there are electric beds. You're going to have some beds that are manual beds that'll have a crank on the end that you'll have to turn to make the height of the bed go up and down, or the head or the foot of the bed go up and down. A bariatric bed is a bed for someone who is morbidly obese. So probably over 300-400 pounds would be a bariatric bed. They have alternating pressure mattresses, which would be to help a person who maybe can't turn themselves, to prevent a breakdown in their skin or a bed sore. So there's a computer on the end of the bed that makes the mattress alternate pressure. And then there's beds that have built-in weight scales in them, which are really, really nice feature. That you definitely see that in the hospital, not so much in the nursing home. Also know the different types of beds that you can make. So there's like a closed bed, which means that the bed spreads up, the blankets are in place. There's an open bed, and that's where the linen's folded down to the foot of the bed. You have surgical beds, and those, make sure to look at a picture of that in the book so you understand what that means. And it's basically the linen is fan folded over to the side. So if you're receiving somebody from surgery, and the stretcher goes up next to the bed, then they can be pulled over and then the linen's placed right over them. Occupied bed means that's a bed that you make while the person is in the bed, and that's a skill that you will be checking off on. And an unoccupied bed just means that there's a bed with no person in it. Know the different bed positions. So you will see this on the quiz. Flat, obviously, it's just flat. Fowlers, high Fowlers, and semi Fowlers. So know the difference in those. You'll see that in the book, and then this gives the description of the different head of the bed degrees of which the different Fowler positions are. If somebody were eating or having difficulty breathing, high Fowlers would be a really good position for them. Semi Fowlers is like more of a resting position, etc. So just check that out in your book and make sure you're familiar with that. Trendelenburg, that is where the head of the bed is lower than the foot of the bed, and this is also helps with treatment of shock. It does require a physician's order. And reverse Trendelenburg helps with gastric reflux, and so that's the head of the bed is higher than the foot of the bed, and it's like kind of where they're in a more straight position in an angle rather than like a sitting position. You'll see those also in your book. Know the different patient positions. So these last several slides are all things that you could see on the unit quiz. So make sure you're going over this. Supine, prone, lateral, Fowlers, and Sims. So you checked off on lateral position last week, which was the side lying position. So that's laying on the side. Prone position, that's on your belly. Supine is laying on your back, and Fowlers is a sitting position, and Sims has like the arm up and the leg up, and so you'll have to check those different positions out in the book. Be familiar with that because you will see that again. And here we've got lateral position, there's Fowler's position, Sims position, supine laying on the back, and then prone on the belly. Just remember that we want to always keep the rooms neat and tidy, keep that call light within reach. We want to make sure the supplies are restocked regularly. We're always looking for any kind of safety hazards, any kind of odors that need to be removed. We're making sure their water pitchers are filled. You gotta be respectful with their property, not like just putting it away where it makes sense to you because that may not work for them. The 5 safeties, there should be a handout, I believe, on this. Check your handout section. It talks about the 5 safeties in the room, so you definitely want to be familiar with that. When we talk about comfort of the resident, think about the noise level, think about odors, think about lighting, and what a CNA can do for that. If you're working night shift and you're out at the nurse's station cackling in the hall, that's preventing a resident possibly from sleeping. If you don't empty the trash after you've changed somebody's Depends and there's feces in that trash can, that the room's going to smell like feces. So, you have to make an effort to make it a comfortable environment for them to be living in. So think about those things. Different linens. This would be if you were making a bed. So mattress pad, fitted sheet, draw sheet, flat sheet, pillowcase, bedspread. You can look at all of that up in the book for the bed making procedure. And then if you are making an occupied bed, you'll want a bath blanket so that their privacy is protected when you're changing the linens. Always remember to change the bed linens when they are wet, soiled, or wrinkled. When you're removing the soiled linens, you want to be wearing gloves. But then once you have removed the soiled linens, you can you don't have to have gloves on when you put the clean linen on. Gather the linen in order of placement on the bed. That just makes it a neater, easier process. And don't hold the linen up close to your uniform because that'll spread germs. So you carry it away from your uniform. Don't, if you bring extra pillowcases or something into a room, then they have to stay in the room or they go in the dirty laundry, because you can't just take them from one room to the next, because that's spreading germs. A couple other things to remember: good body mechanics when you're making a bed. So get that bed raised up to a good working level for you. There's no reason to wrench your back when it takes just a minute to get that bed up. Look for personal items when you're changing the bed. Their hearing aid may be in there. Their dentures might be in the bed. So you want to be watching for those things. Don't shake out your linen. Make sure you're rolling that dirty linen away from you instead of towards you. Do one side of the bed at a time, because that saves energy. Wash your hands after handling the linen.